Good evening, everyone, and welcome to our town hall meeting, From Disparity to Parity, Examining Social Determinants of African American Health. I'm Judy Reese Morse, President and CEO of the Urban League of Louisiana, and we are so pleased to partner with the Louisiana Legislative Black Caucus, led by Senator Jimmy Harris, whom you'll hear from in just a few moments. I want everybody to know that we are recording this town hall meeting. All of the participants are in listen-only mode, and you will have an opportunity to ask questions at the end of the town hall meeting. You can do that by using the chat function to submit your questions. This is the Urban League's second town hall meeting focused on health disparities among African Americans in Louisiana. If you missed the first meeting, please go to the Urban League of Louisiana's website to view it. During that meeting, we talked about the disproportionately high rate of death for African Americans exposed to COVID-19. Tonight and during town hall meetings through Thursday, we want to talk about some of the social determinants that are contributing factors to the disparities that exist. I want to take this time now to thank all of our speakers this evening for their honest and generous stories of experiencing COVID-19, as well as our mental health expert for the evening, Dr. Denise Shervington. And of course, I want to thank again the members of the Louisiana Legislative Black Caucus for their ongoing partnership with the Urban League of Louisiana. Last week, the Urban League released a strategy paper on reopening our state called Reform, Recover, Reopen, Strategies for an Equitable COVID-19 Response in Louisiana. We know that inequities and disparities are historical, but we also know that they are made worse during a crisis. So we cannot miss this opportunity to respond equitably COVID-19 and in a way that makes us all better once this pandemic is behind us. Governor Edwards has shown smart and bold leadership by releasing data by race so that we can better understand the impact of COVID-19. If you want to address a problem, you have to first be willing to look at a situation honestly and with the intention to take the necessary steps to fix it. Sharing that data allows the public to join the conversation and to support finding the answers that make us all better. We also applaud the governor for just moments ago following the data that led him to extending the stay-at-home mandate through the middle of May. The Urban League of Louisiana believes that we have to think about this issue of reopening through the lens of public health security and economic security. We have to protect our frontline workers, our employees, and our children by making sure that we can take temperatures, that we can test, and that we have access to doctors when they're needed. We have to have robust daily sanitation and virus prevention plans in place, and we must have an adequate supply of PPE. There should be resources for renters and landlords so that they aren't pitted against each other and that both are able to weather the pandemic. Renters should not have to worry about having a roof over their heads, and landlords shouldn't lose needed income that keeps a roof over their heads. It doesn't need to be a win-lose proposition. It needs to be a win-win for both, and it can be. And we also have to invest in initiatives that address things like food deserts in our most vulnerable communities. When we think about economic security, we have to think about things like hazard pay for our frontline workers who are most at risk of coming into contact with the virus. We have to support our small businesses by ensuring that they can compete for emergency procurement opportunities, as well as receive on-ramp opportunities to scale up as they need to, and be able to hire those who are looking for work. And we must not forget the fight around the minimum wage. This increases the community's purchasing power and positions our most vulnerable residents for economic self-reliance, which is a part of the core mission of the Urban League of Louisiana. Again, this two-pronged effort will create another win-win situation. These are just some of the issues at the forefront of the work of the Urban League of Louisiana, and we invite you to join up join us and sign up to receive more information on the work that we are doing to serve our communities and all of you. At this time, I'd like to turn it over to Senator Jimmy Harris, who is the chairman of the Louisiana Legislative Black Caucus and represents District 4 in the Louisiana State Senate. Senator Harris.
Thank you, Julie. Everything that you said was spot on, and it could not have been said any better than that. First, I would like to take this time to thank you and the Urban League of Louisiana for partnering with the Louisiana Legislative Black Caucus on this event. Again, this is Senator Jimmy Harris. I currently serve as the chairman for the Louisiana Legislative Black Caucus. And currently on the call, we have several LLBC members, and we would like to thank each and every one of you that have joined so far. At this point in our lives, people, we just have to, make sure that we're taking care of each other and doing the things that we need to do. As we are currently experiencing this horrible COVID-19 pandemic, y'all know one thing simply, and that is we will get through this. We are very, very resilient people, and this too shall pass. But I want to make sure that we understand something. Let's not make a mistake, and let me be clear that this COVID-19 virus is not telling us things that we don't already know. We know that within our communities, there have been suffering. We know that within our communities, there have been inequalities and injustices. And those, these sufferings, those inequalities, those injustices existed, prior to this COVID-19. However, what we can say about this virus is that it's putting the spotlight on issues that we already know. If we look at the Louisiana Department of Health website, and we go to the COVID-19 section, we see these disparities that we see within our communities. We see that just as of today, we have 27,068 cases reported with 1,697 deaths. Of that, if we go by race, we have a staggering 56.25 that are Black. If we go further by ethnicity, and per the website, there are only 3 classes under ethnicity, 74.92% of those are non-Hispanic Latino. And if we look at the top 5 underlying conditions of those that have been affected by COVID-19, we'll see that hypertension leads at 56.15. We then go to diabetes at 34.73, chronic kidney disease at 20.11, obesity at 19.72, and cardiac disease at 18.56. People, all of these things that have been listed on their website are very prevalent within our communities, and we all know that. Having said this, I want for everyone on this call to know that the Louisiana Legislative Black Caucus has, currently, will continue to fight these inequalities and these injustices. So to that, I just want to thank everybody for joining, and I hope that this series of tele-town halls that we have today through Thursday are beneficial to you and those that you interact with. Again, thank you.
Thank you, Senator Harris. And again, we are so grateful to be able to partner with you and the members of the Louisiana Legislative Black Caucus. Thank you so much for your ongoing leadership.
Thank you.
At this time, I'd like to introduce our next speaker. She's Jade Brown Russell. She is a commissioner with the Resilient Louisiana Commission, a commission that Governor Edwards recently announced. She also is the Urban League of Louisiana's chair of its board of directors, and she is the principal in J.D. Russell Consulting. Madam Chair, please take it away.
Thank you, Judy. Thank you so much for your comments, and Senator Harris, thank you for your comments as well. I would also like to echo your thoughts in thanking the Louisiana Legislative Black Caucus and all of its members who were able to join us today, as well as our Urban League Board of Directors for their leadership. I want to thank all of you for just really representing our communities across the state. It is so critical and so needed at this time. I'd also like to acknowledge and thank our governor, John Bell Edwards, as well as our mayor, Latoya Cantrell, and all of the other leaders, the mayors, the councilmen across the state and across this country, honestly. We just heard the news, like everyone else, that the governor has extended the stay-at-home order through May 15th. And of course, we are all grateful, so very grateful for all of our frontline workers who have really put community first, including our medical professionals, but not just them, our grocery workers, our restaurant workers, our garbage workers who are out here still continuing to do their jobs because it is their jobs. And so to all of them, we say thank you. I would also like to thank just all of our families, our mothers, our fathers, our children, grandchildren, for really taking this time to really focus in on one another and for taking care of each other. We know that staying home right now is a difficult thing to do for many of us, but we're not just doing it for ourselves. We're able to look beyond ourselves at this time and really stay home for others. Today's conversation is so needed, and Judy pointed out so much that was incorporated into the Urban League statement on reopening our economy. And it's just the beginning of what we should be talking about as it relates to what an equitable reopening of our community really should look like. We're talking about health security. We're talking about having adequate PPE, adequate access to testing, making sure that people can take off of work or school if they're not feeling well, and have a route to doctors without penalty. We're also talking about economic security, as Judy already pointed out. We're talking about hazard pay for all of those folks that we just talked about who are putting their lives on the line so that we all can make it through this pandemic. And we're also talking about minimum wage. All of these things go hand in hand in order to ensure that we have an equitable reopening of our economy. We have to choose health overall. We must move, as the title of this tele-town hall indicates, we have to move from disparity to parity. And I'm looking forward to this week's conversations during all of our tele-town halls that are to come this week. So again, I want to thank you guys for having me, and I want to just jump in now and move directly into some phenomenal people that we have with us who are going to talk about some of their personal experiences with COVID. And I'll start with our first guest, who is Representative Ted James. He is absolutely no stranger to the Urban League family, as he serves as the director of our Urban League of Louisiana Baton Rouge office, nor is he a stranger to the folks across the state of Louisiana, representing District 101 since November of 2011. You're getting old, man.
Yeah,
And here to share with us about his personal experience and battle with COVID-19, my very, very good friend, State Representative Ted James. Ted, thank you for being with us today.
No, thank you, Jade. And excited. I always, I love to wear both my Urban League hat and my Legislative Black Caucus hat. And, we are always bringing forth the important issues in our community. So again, we're always right on time with elevating the conversation, especially in terms of equity, doing the work that we do every day. And I'm just excited to be on and share a few words with everyone.
Ted, thank you so much, of course, for jumping on. We have all seen the media reports and how you just bravely really offered up your personal experience with COVID-19. Can you tell us a little bit about your experience, just so folks who haven't been as privy to it and close to it, so we can understand exactly the context that you'll be talking about today?
Yeah, and it's interesting that you use the word brave, because as I'm going through it, I feel so far from that. And the decision to really share was one that took a while for me to talk about the things that I went through, especially, the mental aspects of, going through it, and now the recovery piece. And while I feel great physically, there are some lingering questions as I try to answer the question that what is the lesson that God has for Ted, for putting me in the position. We know so many others that have not or did not survive their battle. So for me, it's this lingering question of what's the lesson in this, because I firmly believe that life is different from school. School, we get the lesson and prepare for the test, but in life we're tested, and God wants us to learn the lesson in it for us. So for me, I was the first. We started session, and we left on a Thursday, not knowing what was going to happen, and the NBA shut down that Thursday, so we knew that we would be going back to session on, I believe it was Monday the 15th, to adjourn, and not knowing when we were going to come back. Still, numbers were very, very low. So after we adjourned, I did like everyone else. I stayed very close. This room that I'm in now has been where I've spent 98% of my time for the past month, and didn't do much outside of going walking. I did some walking and jogging around LSU Lakes upwards of that Saturday. I believe it was the 22nd. And Sunday, I woke up Monday morning, well, a few times overnight, with very, very hot. Had to go through two sweatshirts because I was sweating so much. And woke up, took my temperature that Monday morning. It was 102.9. So I got on the phone and had to get tested as soon as possible. And one of the things that is challenging for me, I know, but for me being Representative James, there are a lot of young Black men who were refused tests because you didn't fit what we were told the COVID patient looked like. You didn't have diabetes, you weren't 60 plus, you didn't have hypertension. So many people that I've learned, didn't get a chance to get a test. So for me, I was able to get tested on that Monday. Again, returned home, stayed home, and then on that Thursday, I received a call confirming that I had COVID. And for me at that point, it was just a lot of fear because I'm watching the news, I'm reading every article, and just learning so much and hearing so many different things about what the virus could do. And then I was still feeling fine. The fever never went below 101. And on that Saturday, I started having the shortness of breath as people would drop things off to my door. It was becoming harder for me to just get from the couch to the door to get certain things. So on that Sunday, it just got unbearable for me. So I drove myself to the hospital, went to Baton Rouge General. Within 30 minutes of being there, I was told that I had pneumonia as well. So that's when the fear really started to kick in for me, and was admitted to the hospital on that Sunday. And I was discharged Thursday evening of that same week. And since then,
Wow.
I've been at home. Yeah.
What was the most trying moment for you? How were you feeling really in the most difficult moments of that experience?
Yeah, on that Sunday, I had more fear, and I was thinking more negative thoughts than I was praying. And I've been telling, folks that, and that has been like the most challenging part. And I'm so thankful for so many people and many on this call that were praying for me at a time on that Sunday and Monday when I was, bothered with so much fear because I'm hearing certain things from, the nurses. I have another friend who I went to high school with who's on another floor in the same hospital. He's in the ICU. So I'm scared, still not being able to breathe on my own. Just didn't get out of bed, didn't eat much, and just sitting there, filled with more questions about what was going to happen. It's not like a normal hospital stay when the nurses, number one, you can have family there. So you can't have anybody like a normal hospital stay. So I'm there by myself. The doctors and the nurses are coming in, not hourly like a normal hospital stay. They're only coming in as needed. So I just spent a lot of time in the room by myself, and I felt like the walls, as I was struggling to breathe, I felt like the walls just kept closing in on me. For me, Jay, you know me well. I'm never by myself. I'm always around a lot of people, and I'm always, very talkative. And even in the hospital, I couldn't use the phone a lot because I was having so much trouble breathing. So I'm just spending a lot of time by myself. And it wasn't until probably late Tuesday, Wednesday when I really started to change my mindset, and I decided that I had to fight back. And much to the benefit, I've talked a lot about one of the nurses who I had who really did a lot of encouraging for me, and that was probably the turning point for me when I decided to start thinking more positive.
Wow. So I echo what I said earlier. I know you may not feel brave. You talk about fear and being scared through that process. It is very brave of you not only to go through that process, but to also share the experience with others. Tell me this, Ted. What did you learn as a leader? And I'm going to break this question up, right? Because I want to hear the different versions of you, right? You wear so many different hats. Has this changed you as a leader?
Yeah, most certainly. I've not been shy about just me thinking about my role as a member of the House of Representatives. I'm sitting there thinking that a lot of the things that we constantly debate, some of those things just aren't as important right now to me. And knowing what we're facing, all of the uncertainty, and as I started to get back to looking at emails, I'm seeing so much about we need to return to the Capitol. We need to return to the Capitol. So I've been asking whether or not the next phase for me is going back to the legislature, and if I should be doing something else, and I think that's a question that a leader should be asking of him or herself at all times. And even today, the governor, he extends the stay at home, and then the leaders in the legislature, or those that hold leadership positions, make the announcement that they want us to come back on May 4th. And for me, probably before this experience, I would have said, I have to be there, and because I would be fearful of what folks would say if I didn't show up. But having gone through this experience, there's no question that I don't plan to step foot in that building. And I hope that the people that I represent understand that, because for me, it's my family, my health is more important than that legislative work, and that doesn't mean that I don't still recognize the responsibility that I have to continue to lead. But I just don't know if returning to a place where, forget my experience. We had a colleague that died. We have he died at 54. He didn't survive and have he wasn't blessed to be on a call and discuss, his recovery, because he didn't make it. And we had, 3 other members of the legislature, Ronnie Lyons, who we'll hear from today. And for me, it's like I'm in the hospital, Rodney's battling, Reggie Bagala dies, and folks are wanting to run back when we know that the numbers are still continuing to rise. And as a leader, what I am going to start talking about is, if the numbers in Livingston Parish, Acadia Parish, and some of these other areas look like the numbers in New Orleans and Baton Rouge, we wouldn't even be having the discussion about going back. So if the numbers of people impacted, if we weren't having this conversation because of the issues impacting the African American community, and they were impacting folks of a different community, there wouldn't even be a discussion about returning back to the Capitol while numbers are still trying to rise. So, you know, elevating that conversation. And for me, I don't have to be in the Capitol to do that. So as we think about, or as I think about, again, back to the lesson, you know, I don't know if the lesson is to go back to the Capitol, quite frankly.
Wow. How did it change you as a father? I know you have
Oh
a
man.
baby girl. How did it change you as a father, as a son, as a member of your community outside of, you know, the state, what the things that you do at the state capitol?
Yeah, you know, being away from my baby, I didn't. This past weekend was my first time. You know, really, she was here for the first time in over a month. So being away from her was, you know, probably the hardest part of all of this. You know, thank God, you know, her mom was able to really, while she was working and, you know, there by herself, you know, for a month caring for it, you know, thank God her mom was there to really, really, you know, take care of our baby. She just, you know, thinking about her is another reason why I don't see myself going back to the Capitol. Because some folks are saying, oh, you are protected, you're not going to get it again. And some doctors are saying something totally different. I can't, when I look at Harper, I can't take that risk. And I'm not going to, you know, be able to look at her and go back and put myself in a position where something may happen, because there's no way to isolate in a body of 104. Like, there's no social distancing that we're going to be able to do in the Capitol. So as a father, I can't go and put her at risk. There are, you know, just different things that are going on in the community. Folks are handing out masks and bringing food. And while Representative James may want to go out there, Harper's dad is like, I'm not going, and I'm staying in the confines of this house, because I just have to make better decisions that impact her.
I really want you to talk not to Jade, but to the community. We have hundreds and hundreds of people who are watching today. What is it that you want them to know? What is it that you want them to be thinking about as we start these conversations about potentially reopening of our economies? Just talk to them for a minute.
You know, the first thing I want people to understand is this can happen to you. You know, it doesn't matter. We've seen case after case of, you know, young. There's a 5-year-old that died. I'm 38. Like I said, we had a colleague that's 54. This virus is truly attacking our community. And as I went to get some gas and I ordered some food last week, the guy who came out to bring me my food, he didn't have on a mask. The young ladies that were walking, taking orders, they didn't have masks, and they're out handing people menus if you hadn't ordered online. And I turned around and didn't get the food because I didn't feel comfortable. And for the community, I need us to realize that this virus is still very much a problem in our community. It's still attacking our community. And Senator Harris, Chairman Harris, he told you the numbers in the African American community. We have to take this serious. I ride around and I see so many of us that don't have masks on. I see different businesses that aren't, went to pick up groceries. The guy that was out getting the grocery baskets, he didn't have on a mask. He didn't have on gloves. So I still see that people are not taking things seriously. And I know because I'm very much so on social media. What Easter was a couple of weeks ago. And I hope it doesn't. I hope I'm wrong, but I know that folks out there were balling crawfish. Folks out there were hanging out during Good Friday and Easter. And I know that because I saw it, I witnessed it. You know, they were in groups much larger than 10, and you don't know where those folks had been. You don't know who they've been exposed to. So we still have, and again, I hope I'm wrong, but I hope we don't see another spike when we get to, you know, 2 weeks post Easter, because I know we were out there being very relaxed on social distancing. And then when we get to this recovery piece, you know, we have our folks are the ones that are out there getting unemployment now, and it's very, very low. But I'm hearing that there are so many other people that are making more with unemployment than they were with, you know, the job that they had, because we don't have a living wage here. So the other piece is this recovery for us, the economic recovery is probably going to take us a lot longer. So let's start, you know, make smart decisions with those checks that many of you who receive stimulus, make real smart decisions with those. Those business owners, if you are out there applying for all these different programs, read the rules and make sure that you're doing every single thing to, you know, check every dollar that's spent. Because I know with these federal programs, it might not be this year or next year, but there's going to be an audit at some point, and many years down the line, we seem to be the ones that they come after for, and not that we've done it on purpose, but for mistakes with a lot of these federal programs. And that's why, you know, it's important, business owners out there, contact the Urban League, because we have not stopped working. We've only pivoted in what we've been doing, and now we're helping small businesses, you know, apply for those programs. We're giving out that information. So those small businesses, if you have questions, you know, reach out. We have not stopped doing that work, and we're helping folks through the economic phase of what's next for us.
Ted, thank you again for being with us today. Thank you for your courage. Thank you for your leadership, your transparency. Thank you for your truth. Your leadership, of course, not only extends in the legislature, but you're leading us even right now. So we appreciate you again. And please take care of yourself and your family. We love you.
Thank you. Love you too.
All right. Next we have Representative Ronnie Lyons, who is here also to talk with us about his personal experience. There he is. Very good to see you, sir. Mr. Lyons represents District 87 in Jefferson Parish. He is actually my representative. But before that, he was known long before he became a representative at the state capitol. He is a retired supervisor with the Jefferson Parish Street Department. He is a former coach and youth basketball league worker. He is the former president of the Woodmere Civic Association. And he also really refers to himself as a quick study who has, and I agree, has his finger on the pulse of the community. And we absolutely concur with that. Mr. Ronnie Lyons, Representative Lyons, how are you today? Representative Lyons, I think you have your mute on. Take your mute off.
Check that out. Now
yeah, there we go. We've got it now.
All right. But
how are you today?
I'm good, Jay. Thank you for having me here. And always, you know, it's great working with the Urban League from the Black Caucus standpoint. We have a great opportunity, and we've been taking that opportunity to educate the masses and really inform our people how things work and how to better themselves overall. So it's great being here.
Like Ted, you also have experienced COVID-19 over the past couple weeks. Tell us what your experience was. I want you to share with the public what that experience was like for you.
Well, the experience for me was, I don't know, it took several turns, from concern to crisis management, and there's always a moment of anxiety when you deal with the unknown. And it sounds like you know me a little bit from the intro. I'm always a person that tries to manage crisis, manage things. And when we went to Baton Rouge on, I think it was March the 8th, was the first week we were up there. And it was a week later, well, around the 16th, 17th, when I decided, when I felt that something was wrong with me. I was having a conversation the night before, me and my seatmate, and we just, and I was talking to him. I'm like, something is not right. here something is just not right. And so he was like, we feel the same way. And that night I just felt eerie. And the next morning when I drove back, got ready to drive back from Baton Rouge to home, I still had the feeling a little bit. And then I know my body pretty well. So I just checked my temperature and it was a little warmer than normal. So I immediately quarantined myself from my family. My first thought at that point in time was protect your family. That was first and foremost. So, I quarantined myself and took the Tylenol and drank liquids. And at that point, it was probably about 24 hours later, I had to realize, that I have to make decisions about what I'm doing. My first thing was to protect my family, quarantine. So I got in touch with, some of our state health people because, and if you believe it or not, there wasn't anybody talking about COVID-19 except, maybe the governor's office and a few warnings you heard. There was no real in-depth information about how we should respond to this thing other than at that point in time, it was like no shaking hands, never be in a room of more than 250 people at that time. And that's all we were doing. Little and behold, there was a lot of gatherings of people sitting side by side, even in churches. I attended a funeral on the 13th where there was, a church full of people and several funerals and things in the district at that time. But when I felt like, I needed information, I contacted them to see what they knew. And my first call after that was to my primary care physician. And at that time, then you found out that, hey, we're not taking any appointments in. Everything has to be, telemed, and then we'll decide what we're going to do. So I did that and continued to quarantine myself. And I went out and got a test, which was first. It took almost 9 days to get, to get the results back. But as the information was to me and to a lot of people, once you feel those symptoms, you have to presume that you are positive in doing so. And I have a great support system, which I'm blessed to have. And it got me an opportunity to see how other people do things in the process. And I never wanted to be seen as Representative Lyons anywhere. I was always just a guy coming for medical help. And I got to watch other people. But when I was a young boy, 15 years old, I had pneumonia. I was in high school. So I understood the feelings of things that happen to your body. And I know my body pretty well. So after watching all of the countless and endless shows and interviews about this virus and how it attacks you, I was determined that, if it got into my lungs, I would have a problem, knowing what I knew from, a young age. So I did the normal things. I took the Tylenol. I tried to make myself drink as much as I could. I never had any, major adverse problems except the fever. So periodically, I was counting my days because they told you if you have 3 days without any fever, any medication, you should be okay. So 3 or 4 days passed. I still had intermittent fever. So I started to challenge myself. I would walk, long, periods of time just to see, how I felt. And I think it was, I want to say maybe day 12 or 13, after me being, confined, that I decided to, walk further because I felt, a different feeling in my chest. And that was a familiar feeling that I've had. You never forget certain things. So I immediately took myself, against my family's advice, I took myself to the hospital and to the emergency room. And, the doctor told me, he said, listen, you had a chest x-ray. I had one when I got my test. I really fought for that. And it was an argument to get them to do what I wanted them to do for me. And I wanted to establish a record of all of my visits. So I asked the doctor, I said, well, listen, this is my symptoms. I said, I'm developing what is called bilateral pneumonia in my lungs. And you will check my x-rays from the last one I had over 72 hours ago, and you're going to see some difference because I feel it. He said, well, sir, all I can do for you, there's no cure, is treat your symptoms and you can go back home and you can come back when you feel better, you feel worse. I'm like, you got to be kidding me. He said, well, what do you want me to do? Take somebody 84-year-old grandmother out of the room and push her in the hall for you? I said, no, sir, I don't. But I don't want to die either. I said, but I need you to take another x-ray so you can chart the progress of, you know, my condition. So he goes out and he comes back and he says, well, you know, your lungs is at 98%. I said, no, sir, they're not. I said, that's what you see from my chart from my last visit, because you have my records. And he goes back and he says, oh, yeah, you're right. But I can give you an x-ray, but you're still going to have to, you know, leave. I said, okay, fine, give me an x-ray. So I had to leave the hospital and come back home. And I was counting my days, and I went approximately almost 48 hours more before I decided to test myself again. And I took a longer walk, and I double paced myself, and I felt the tightness in my chest, and I felt the adverse breathing patterns. And then at that time, I was under the nurse's care of my daughter. She was like insisting, you know, that, you know, you do this. And I said, well, we got to calculate how we do this, because the last time I went, they sent me back home. And this time when I go, I got to make sure that, you know, they don't send me back home, because it's not going to be an option. So, you know, she, you know, worked with me and she got me there. And when I got into the hospital, they kept me there for a while outside and they let me in. And, you know, I have a sister who's an excellent nurse, and I have another sister who's in the healthcare, you know, business as well. And my nurse sister, she was there with me, you know. So she's like, you got to make sure, you got to fight that they do this and they do that and do this. And I'm like, okay, but this is, keep in mind, this is not normal, because there are a lot of people lined up in that room and we're just waiting to be seen, just like I was. So I told the doctor, I said, when she came in, I said, ma'am, listen, I know you're going to look at me and I'm going to ask you before we start, I need a chest x-ray. It's going to show, you know, forming of bilateral pneumonia in my lungs. And according to, you know, the guidelines, you have to treat me for it, you know. And she said, treat you for it? I said, yes, you have to treat me for it. I said, azithromycin is the drug that you use. And she looked at me like, you know, how do you know this? And I'm like, well, I know me and I know the procedures. And when you do that, you're going to see there. And, you know, at this point in time, I called my sister again just to make sure I said the right thing. And the nurse came back. She said, you know your body, you know your symptoms. And we did see the formation you're talking about. And I say, when do we start? And she says, when do you start? So she left out. And a nurse came back in about half hour later with some IV. She said, we're going to put you on antibiotic and IV and be treating you for pneumonia. I said, thank you. I said, are you going to do a blood culture? She goes, yes, you're going to do a blood culture as well, to see, you know, how this is affecting the rest of your body. And during that whole period of time, I wasn't afraid, you know, because I was trying to be strategic about my own condition based upon what I knew. And I didn't want to, and I was not going to accept anything like going home. I was not going to accept, you know, because I knew what it would have been for me at that point in time. So, you know, I encourage everyone, when you know your body, and if you don't know your body, always get checked and always ask the hard questions. That's important. So when they decided to keep me, to give me the fluids, give me the antibiotics, they said, well, we're going to keep you to do that. At that point in time, miraculously, that night, my fever was gone.
Wow.
Didn't know what happened. You know, it was a lot of prayer, a lot of things going on, you know, that you understand, but the fever went away. And it was an eerie feeling. So I really want people to know, you know, when people are hospitalized under this thing, how lonely it is. Because you're on the floor and everyone in there on that floor has COVID, and you're in a room and they tell you can't come out the room. What they didn't tell you was nobody's coming in the room.
Mm-hmm.
So I never saw a doctor anymore. We talked on the phone. Every morning I would talk to the doctors on the phone about my condition and relay information to them, other than the nurse coming in and getting your vitals. And those are some amazing people who come in and do that and take good care of you. And through, you know, my information, I was able to talk to the doctors and chart a path to, you know, get my antibiotics in me. And I felt better immediately the next morning. But you still want to make sure, you know, that your oxygen level is up. The things that you think are normal and feeling okay may not be okay. You know, so, and I heard you ask Ted earlier, you know, about his scariest moment. You know, and I'll just go straight to mine. My scariest moment at that point in time was, you know, once they got me in a room and I was there, and normally a doctor would come in the next morning and talk to you and tell you, you know, this is what we have, this is what we think, you know, and so forth. But like I told you, no one came. So I'm sitting there and I'm in the bed and I'm thinking, you know, this is the point of no return. Because the doctor talked to you and over the phone and gave you what they thought was the situation and how they wanted to treat you. And you make, at that point in time, you have to agree to or don't agree to a lot of things like DNR and intubate, you know, when they want to intubate you, you have to agree to those things. And I'm sitting there saying, you know, I worship a good God. I don't really need that.
Yeah.
But when I think back and I say, well, think about your family. You know, okay, whatever measures, we'll do that now. But that 12-hour period of not knowing how the medications were going to react to your body, whether or not the virus was going to progress and win, or whether or not, you know, you were going to overcome that point, because the doctor said, you know, it depends on what your body does, you know, right now. And so I made a bunch of notes that night to a lot of people, a lot of different things, you know, that you just wanted to think about. And I didn't sleep because I wanted to make sure everything I needed to do, you know, in there. And I did. And about 4 that morning, something came over me and said, look, you're going to be fine. You know, you can put that paper, pen away and go get some sleep. And the nurse came in and was like, why are you still awake? You should be resting. I'm like, I got things to do. And so, you know, it was one of those things.
Your story, along with Ted's story, is just, I think it is so real for us because you all are being so transparent. I want to thank you, Representative Lyons, the same that I did with Representative James, for leadership. This is leadership. Even in the midst of a personal experience, you all are showing great leadership in the community and helping us understand what this looks like and how to conquer it and how to beat it. And we have a number of other people on the rest of the panel today who are going to talk, especially our next guest, who I'm going to shift to now. But Representative Lyons, I want to again thank you so much for just telling your truth and your experience. I see you putting your finger up at me.
Because I want to say one thing before I'm going. And one of the things that's not one of, but the most important thing is, you know, now that I'm out and about in the district, I want people to know that you can recover from this thing. But one of the most important things is the lesson that I learned being just me, not Representative Lyons. You know, we have people who live 6, 7, 8 people in a household, one bathroom. How do you social distance? Better that, how do you quarantine yourself? You know, there's nowhere for people to go. As we go forward, we want people to know that you have to make those decisions too. We get a hurricane plan. We have to have a plan for this right now. So when you got relatives, which is why we have so many, you know, families who've been affected, so many things that happen when people can't get away or people don't really understand the guidelines of how to, you know, be self-disciplined and how to really clean and be disinfectant and so forth. And even when you go into these hospitals and so forth, you have to be really, really cognizant of what's going on with you. And that's the most important thing. And as we go forward now, you know, my biggest goal is, you know, I'm in great health. There's other people who are in great health, and there's people who are not. You know, we know what the morbidity is. We know the conditions. As a people, let's get healthier. Let's get more involved in all these things that's going to be really, really relevant in the next months and coming days. So that's the message I want people to know. and we're going to continue to fight. We have to. Now you can go.
Representative Lyons, thank you so much again. I could not have said it better myself. You definitely had the last word on that. So thank you again. We're going to move on now to our next panelist, Dr. Denise Shervington, who is well known across the state. She has an intersectional career in psychiatry and public mental health. I am so excited to have her here with us. She brings such a unique perspective and expertise to the conversation. Dr. Shervington, are you there?
Yes, I am. And I'm so blessed to be here.
Thank you so much for joining us.
I'm happy to be here and humbled and honored by the braveness of your two prior guests who were so willing to share what their experiences were. So thank you.
So Dr. Shervington, I know you are the founder, for our guests, you're the founder and CEO of the Institute of Women and Ethnic Studies. And as you pointed out, we just had Representative James and Representative Lyons and so many others who may be watching or who have family members who are watching, folks who have recovered from exposure to this virus. And listening to these personal accounts, what are the mental health considerations? This is something that I've been really thinking about lately. How will we emerge out of this from a mental health perspective? What are those considerations for anyone who's gone through this experience? We just heard Representative James talk a lot about his mental well-being. Dr. Shervington, you there? I think we may be having some technical difficulties with her. Dr. Shervington? All right, we may have to actually come back to her. We won't lose this line of questioning because I think it's so important. But we'll work out the technical difficulties there. But we're going to move on to Ashley Briscoe, who is the daughter of Pastor Stephen and Barbara Randolph from Lake Charles, Louisiana. I had the privilege of having a very quick conversation with her earlier. And she has a phenomenal story, just a heart-wrenching story as well. She has lost not one parent, but both parents to this horrible COVID-19 virus. She has really been very transparent with her experience, and she's here today to share some of those thoughts with us today. Ashley, are you there?
Hi, yes, thank you for having me.
Hey, Ashley, thank you so much. You know, we spoke earlier, and I will reconvey our deepest condolences for your loss of both parents to this virus. But thank you for willing to share your experience and your story with us tonight.
Thank you for having me. I'm honored.
Thank you. Please, Ashley, if you could, please just let us know a little bit about the experience that you had last month. How are you? How are your family now doing, dealing with this tremendous loss from your family?
Well, this whole experience has taken us down like an emotional roller coaster. Of course, there's sadness, frustration. I guess the biggest one of all would be the feeling of confusion. Like this whole thing has been confusing. My dad name was Pastor Stephen Randolph. My mom name was Barbara Randolph. My mom was 58. My dad was 64. And we were married for 38 years. And on April the 11th, they both passed away from the coronavirus. So the whole thing is still confusing because there's a lot of questions you ask. The question of my parents were 58 and 64. So the one thing you're not prepared to do is lose one parent. You go from last month, I was literally talking to my mom about planning something for my dad's birthday, until this month that not only is my dad gone, my mom is gone too. So there's a lot of questions that you ask yourself, like, why did this happen? Why wasn't we more educated to be prepared for something like this? Because they both had pre-existing conditions. My dad had hypertension, my mom had diabetes, so it was harder for them to fight against the virus as it would be for someone that didn't already have these conditions. And I feel as though that had they been more educated on these conditions, they could have taken it more seriously. So we have those questions. And then you also have to deal with the fact that you don't know what to do at this point, like you're in limbo, because you can't have a funeral service for them because you have to quarantine, you have to stay at home. So there's no way for us to have a funeral. So with not being able to say your final goodbyes, it's like there's no closure. So it's like every morning you wake up and it's like happening all over again. So
Right.
so with that, yes, ma'am.
No, go ahead. Go ahead. Continue.
And also, like, while they're in the hospital, you wonder, were they receiving the proper care, because you can't literally talk to them. They were both sedated, so I couldn't literally talk to them. I couldn't physically see them. So it's like my only communication is with the nursing staff, and I would talk to the doctor maybe once a day. So I know they got tired of me calling because I called like every hour. They were like, no change, no change. So that was my only communication. So it goes from not being able to talk to them to having to say your final goodbyes to them via virtual call, like a video call. So they weren't able to see me, but they can hear me through the video call. So the only comfort that I do get out of this whole thing is not being confused about the fact that I know that they're in a better place together. My mom always said she couldn't be without my dad. My dad always said he couldn't be without my mom. And they died that day together, holding hands. My mom died first. My dad died shortly after, while holding her hand. So that's, to me, was a sign from God, just honoring them and honoring their love and their dedication to them, to him. So that's the only thing that gives me comfort in all of this. Everything, and I'm fine. I'm okay with that. As long as I know that, I'm perfectly fine. Everything else that I feel is just pretty much human feelings. You're gonna be sad. You're gonna be hurt. But my dad always told me it's okay to cry. But if anything ever happened to me, cry and then rejoice in knowing that I'm with God. So that's the only thing that gives me comfort.
Yeah. Thank you, Ashley. Such a just heart-wrenching story. And I know you also had, am I right? You also had your sister who also suffered from this virus as well.
Right.
So you've had several experiences with this virus. Can you share with us, those who are watching and tuning in today, what would you what would you share about how you're doing and not now and how to get through it? How did you get through these moments?
I would say that the support I got from friends and family and just strangers just reaching out, you know, saying that they're praying, like people telling me their stories of how they knew my parents and how that my parents impact their lives. Just thinking on the good things, the time that I did have with them, that gets me through it. Also, being able to tell their story gets me through it. Being able to let my family and friends know, hey, if you just have a cough, don't take it lightly. Do whatever you can to stay as healthy as you can. So just being able to know that that's what my parents would want me to do, just spread the word and make people aware of this as much as possible.
Okay. Well, Ashley, I want to thank you again for being here and sharing your story. I commend you because even in the darkest of times, you've been able to really find God in this entire experience. And so I just personally want to thank you for that. We will be praying for you. The Urban League family will be praying for your continued strength through this. And as I chatted with you earlier, you please make sure that you let us know if you need anything from us, and we sincerely mean that.
Yes, ma'am. Thank you so much.
Thanks again, Ashley. I think we're now ready to move back to our expert, our mental health expert, Dr. Shervington. Dr. Shervington, are you there?
Yes, I'm here. Can you see me?
I can hear you. I can't see you yet, but I'm sure it's coming. But I do want to thank you for standing by to work through those issues. Dr. Shervington, as you pointed out before we got cut off earlier, Representative James, there you are. There you are.
Okay.
Representative James and Representative Lyons and so many other folks have recovered from exposure to COVID-19. And listening to their personal accounts, what are the mental health considerations? I mentioned earlier, that's something that I've constantly been thinking about. Mentally, what are we going to look like when we come out of this experience?
Okay, and before I get into that, I just want to thank the Urban League for recognizing that without health, there is no wealth. And so even moving forward this conversation, I just want to applaud the leadership. When disasters and crises like this happen, our body goes into the fight or flight experience, meaning that there's a threat and we're going to have heightened emotionality. That is very, very normal. In fact, if we're all not a little bit anxious, we should be concerned because there's a real threat and our body is wired for survival. So what can happen if we don't know how to manage our anxiety, to work with it? Then we can go into more clinical experiences of anxiety disorders, such as having post-traumatic stress disorder or having depression, or for some people, getting into bad habits, using more substances, or even being aggressive. So it's really important, and I thank you for having someone like myself on who can talk a little bit about how we can manage through the heightened anxiety, because it is normal. It is normal to feel a little nervous, maybe even a little bit angry. And for the people who've had these losses or the people who've had to suffer, there can be some sadness and some grief. But we can make our way through this if we pay attention to what it is we're feeling. And, we pay attention to our bodies, at the same time we're paying attention to our mind. I heard the first representative talk about his fear. Fear is normal, but how do we manage it? How do we go through it? And what I understand him from saying, and also the second speaker, was figuring out a way to get some meaning and some understanding from the fear that we're experiencing. It was, on one hand, it was telling the second speaker, maybe you don't want to sleep. That seemed like he was having some real death anxiety at that time. And it is the body trying to protect us. So how do we manage that? In all the stories, and my sadness also goes out to your third speaker, I think her name was Miss Ashley, the sadness
Yes,
and the
Ashley.
grief. Yes. Is that, sometimes in times like this, how do we turn these lessons from our existence? How do we turn them into something that can be healing? And the best advice I could give is to face them. You have to confront and name what it is you're feeling. So the first representative said, I was feeling fear. That is the beginning actually of the healing process, is when you don't know what you're experiencing that you can get into trouble. But one of the things that one of the wise men amongst us said, Mr. Nelson Mandela, that courage is not the absence of fear, it's the conquering of fear. So knowing that it's there, not being afraid of it, sitting with it, looking at it, trying to understand what is this trying to teach me. What a lot the two gentlemen said, and I've heard this before, is this feeling of isolation. Being by yourself. This virus puts you in a room, you're distanced from people, you're physically distanced, sometimes even socially distanced if you're in the hospital. And so how in the aloneness you don't become lonely? How do you try to find some meaning in the solitude that you're experiencing and not be afraid of it? Also, I think what was said or might not said, which would happen to any one of us confronting this virus, is the fear that we're going to die. And sometimes for many of us, it's even hard to say the word death. But this is what the virus is bringing us face to face with, the possibility that we could be harmed and that we could die. So what are the ways, the tools that we have for recognizing and dealing with the reality of our lives, that as much as we were born, we're going to die. And so by looking at death, there in some of our indigenous cultures, people would wake up every morning and be very thankful, knowing that they could not make it through the day. So how do we turn up? How do we find meaning? And this is what I heard all of your panelists talk about today, finding some meaning in life. How do I make sense? How do I have the optimism? How do I have the hope to know that there is some meaning, there's some purpose for those who have survived? There was some purpose in this experience. What can I get from it? And hopefully to make me a more at ease person, to help me to transform the suffering that I have experienced into some kind of new way of feeling joy again. And so, as I said, we should expect, especially if we've suffered through this, either from losing someone, the processes of grief. If I have some time, we can talk a little bit about that. But how do I accept that this is what has happened to me and I can find a way to make it through? Because we don't want to go on to develop clinical mental health challenges. And even if we do, even if we become so overwhelmed, I just want to put it out there that there are mental health services that are available. If someone feels that they cannot manage the anxiety, they cannot manage the depression, they might find themselves reliving what happened to them or what happened to someone else, knowing that it happened to someone else, then that might be a sign that you might need some mental health support. And those services are available. And if there's a chat box, I can put some of those numbers in there if people are interested, if people ask for it. But the thing that we have to really do during this period is come to terms and accept that we are going to experience some degree of emotional distress, but have the hope and the optimism and the courage to know that with proper supports, whether it is from our friends, and oftentimes now that has to be virtual, or if it's with a licensed professional, we can make it through this crisis and we can be okay. And for some people, we can come out even better on the other side of this.
Dr. Shervington, thank you so much. I think whether you have personally experienced the virus or whether you have had someone in your family or close circle, I think you hit the nail right on the head. I think so many of us are really beating ourselves up, if you will, for having those anxieties and fears that, to your point, our systems are really designed to do this. So thank you again for your expertise. I could literally sit here and talk to you all night. I know we have other guests that we have to pull in at this time, but Dr. Shervington, again, thank you so much. And we do look forward to hearing from you again in the very, very near future. So thank you.
Thank you so much. And again, my deep compassion for those who've had to suffer through this, and may they find ease and health again.
Thank you. Our next panelist is Mr. Robert Taylor Jr. Mr. Taylor leads a group called the Concerned Citizens of St. John, which has been advocating on behalf of the people in St. John the Baptist Parish, which is a small rural town in Louisiana that really straddles the Mississippi River and only has a population of about 43,000 folks. And his parish has become known as having the highest death rate per capita for coronavirus, not in the state of Louisiana, but in the country, according to the New York Times. It has even surpassed some of the most densely populated urban hotspots that are also being crushed by the coronavirus. Mr. Taylor, are you there?
Yes, I am. I'm here.
Hi, Mr. Taylor. Thank you for being with us this evening.
You're quite welcome.
That you, thank you. We know that you're a resident and advocate of St. John the Baptist. Tell us what has happened there.
Well, you've been talking about it. It's been a harrowing experience for us. It is for us in the parish. We've been fighting this. We've had a serious health issue here, for decades now. And this organization was founded in 2016 when we discovered what was at the root cause of the health conditions that we were suffering from, the cancer, I don't want to say it too lightly because it's not very pleasant. And we had respiratory issues, cardiac, kidney, so many issues that we were suffering from at normally high rates. Originally, we could not figure what it was about. We didn't know that it was something that was unique to us because it was caused by this chemical plant that had been set right in our midst, right in the middle of our community in Reserve, Louisiana. And we discovered this. We had help. We had universities came in, and Stanford University sent the epidemiological team down to St. John to do health surveys and studies, and they came up with the facts on this situation. They discovered that our proximity to that plant determined our health. The closer we were to that plant, the more we were exposed to to the emissions that were being emitted by DuPont Danker Chemical Company, the higher was our morbidity. People were dying. People had cancer. They had respiratory, so many issues. And when we began to find out that it was actually related to DuPont Danker, we've been struggling, trying to get them to have some compassion and consider our lives, consider the lives of our babies and our grandparents, all of our lives. And mostly it fell on deaf ears. Now, after years of exposure and the onslaught of this plant and the primary chemical that was affecting us, chloroprene, that was emitted by this plant. No other plant in the United States, 99.9% of the chloroprene emitted in the United States is dumped on our poor little community. And as a result, our immune system, after having been under attack for decades, made us the most vulnerable group of people in the United States. And we are realizing that with the horrible death rate that we're suffering. So just after the 4 years of our struggle and our advocacy, without getting any real results, here is irrefutable evidence, the bodies that are stacking up, the number of people that are affected or infected with this virus. And the primary cause is our diminished ability, our body's diminished ability, because of the effect chloroprene has on our immune system. And when I say these things, we have scientific corroboration for the negative effect, the deleterious effect that chloroprene has on the human immune system. I have a daughter who has been attacked. Her system, she's suffering from a very rare immune deficiency disease. The number, it is so unbelievably remote that she would contact this, but that was compounded by the fact that 3 other young ladies in the same community with this same rare disease, and one of them just died. These are ladies in their 40s, late 40s. We have so many issues that go directly to this chemical plant, DuPont Danker, primarily DuPont. DuPont has been there since 1968, 69 in operation, dumping these chemicals on our community. And all we've been seeking all along is just some redress. Just give our community and our bodies a chance to recover, to be able to fight diseases like this disease that has come upon us. Too late for us now, for the people we've lost and for the people who are being infected every day. It's there for the world to see the unholy rate, the devastation of losing, like Miss Ashley, you losing both parents. We had Prophet Antoine Jasmine lose his mother and father within hours. We lost the Belvin family, Junius and Mary, within hours of each other. What is this monstrosity that it just comes in and decimates families and takes, and It's people are so, in our community, people are so disturbed. They are so afraid. They don't know what to do. They don't know where to go or what to think of, how to even think about seeking relief. We've been on the battlefield for 4 years, and all we are asking now is that since everybody is aware that chloroprene is what's causing our defenselessness, that we at least not have it while we are fighting this pandemic. Is it too much to ask? They shut our churches. I heard one of the guys say he didn't have a haircut. I don't have one either. They shut our barbershops. They shut our schools. You mean to tell me they can't shut down this DuPont Denker plant that's producing a non-essential product, but it is killing our people? We are the highest in the United States. Of all of the counties in the United States, little St. John the Baptist Parish, how could it be that disparate a number? How could we, we have so many deals, so many battles that we have to fight. Being a predominantly Black community, okay, national level says we are automatically 70%. Just because, we're making up 10 to 12% of the population, we're suffering the brunt of this at 70.5%. Then you come to the state of Louisiana, where we are 32%, we're still 70.5% of the morbidity rate. Then we got to deal with St. John the Baptist Parish, where we are the highest in the country. And everybody knows, all the scientific evidence says, chloroprene is the culprit. Why is it that, I'm sorry, go ahead, please, because I will ramble on about this, because I'm so passionate about this, and I'm getting so frustrated after 4 years of this. And even now, when all hell has broken loose in St. John the Baptist Parish, we're still getting this nonchalant attitude from the people in the places that should be standing with the poor people.
Yeah.
I'm sorry, go ahead.
No, Mr. Taylor, thank you so much. One, for your relentlessness, just to hear how long you guys have endured the issues that you're enduring in St. John the Baptist. And now to see it in a different light, with the coronavirus and the impacts of all of the disparities that existed long before we ever knew what COVID-19 was. What is it that you would like to see happen during this crisis to begin lowering the number of African American residents who are not just at risk of COVID, but of all of the other disparities that you talk about as it relates to the various chemicals that are present in St. John the Baptist? What is it that you want to see happen, and tell us what we can do to help?
All right, thank you. I heard one of our panelists say that wealth without health is it's crazy to talk about that. So the thing that right now our people need to stay alive. The number one thing we can do is reduce the attack upon our people. If we can stop the we don't want to ask them to go out of business. Everybody in America is not going out of business. America is taking very, very positive steps to fight this. Why can't this chemical plant stop this for a short period of time We're not asking them to go out of business, to shut down permanently. Can you please just stop compounding and increasing the number of deaths, compounding this issue that we have? You know that chloroquine is affecting us negatively. Can't you just stop that for a month and give these poor people a chance to survive, to try and survive this? All we ask is the people in responsible places who we don't want to ask them to come out and tell DuPont to shut down, that we don't need them or want them in the community. We just ask that at this desperate time for us, that they would go to these people and ask them to please stop poisoning our people in St. John Parish. Anybody with influence and authority that can maybe get to the conscience, if these people have a conscience, they are aware, they know everything about that chemical. They know how it affects the human body. They've known it since they invented it in 1931. They know. It's up to our people now. We down here on the ground in the community, our poor people who have been fighting this chemical giant for 4 years, we need the help of our elected officials. We need the help of the people who we voted in office to represent us. Just help us. Just help. Just go to ask DuPont. My impression in the 4 years of this advocacy, please let me just say this, is that DuPont owns the state of Louisiana, especially the parish of St. John. I was attacked by our sheriff department because I was walking on the levee and they told me that levee belongs to DuPont Chemical. And the officer looked me in the eye and said, if something happens to DuPont tonight, I'm coming to get your expertise. I am a citizen of St. John. I was born in Reese, Louisiana. I grew up on that levee in that community. I think the police department should be protecting me, not DuPont. I think that LGEQ, they are the agencies that have been appointed to regulate industry and to protect us from industry. Instead, Mr. Charles Brown of LGEQ came to St. John Parish and attacked me and my organization. I want to say this where some lawyers, I hope, can hear this, where some legislators can hear this. This man came before our school board because we had petitioned the school board to protect some of our children who are being poisoned. They're only 1,500 feet from DuPont, and they're being poisoned by 400 times what EPA says is a safe level. He came in front of our school board, turned around and pointed to me and said that I was a fearmonger and that nobody in St. John should listen to anything I said. This man, he is charged with protecting us. And he come in and attack us. LGEQ has failed us miserably. They have shown us that they are working in the interest of DuPont Dinka. I don't know about the rest of the petrochemical industry in Louisiana, but Charles Brown is a proponent and a protector of. And therefore, all of the suffering and dying that we're doing, he is aiding and abetting that. And I'm just so frustrated with this that I'm trying not to just to take off in this direction. I'm sorry, but whenever I think about it, and when I think about what we really need, we need our people to not be dying. Don't tell me about the economy and don't tell me about the jobs. They are no good to dead people. None
Mr.
of that
Taylor,
helps dead people.
Mr.
Yes,
Taylor,
ma'am.
do you have a email address that you can share with us so that people who want to reach out and support can do so? Do you have an email address that we can post?
Citizens of St. John
Citizens of St. John Parish
at Gmail.
at gmail.com.
Great. Mr. Taylor, I can't thank you enough. Your conversation has just been absolutely moving. And it reminds me that, when folks say, we need to get back to normal, normal has not been the best situation for some of us. And I heard that loud and clear from your comments today. So thank you again. And we look forward to continuing the conversation around the issues in St. John the Baptist Parish. So thank you.
Thank you very much.
God bless. At this time, we're right at the 6:30 mark, which was scheduled to be the end of our webinar, but we do want to leave this time for some questions and answers. And it's my understanding that we do have at least a couple questions that we want to make sure we get responses from our panelists for. Our first question is actually for Representative Ted James. Representative James, is there any talk about increasing the state's unemployment benefits? Ted, are you there?
Jay, can you hear me?
Yes, we can hear you.
Yes, so there's actually a lot of conversations, quite frankly, and you guys will probably be surprised. There's a bill to actually not only decrease the amount, but also decrease the number of weeks in which one would be eligible. Now that bill was filed before session was pre-filed, but there's been a lot of talks amongst many members on this committee. We're blessed that the vice chair of the Black Caucus is the chair of the House Labor Committee. So there have been a lot of conversations about using that bill as an instrument to increase not only the number of weeks, but increase the benefit. We have the lowest benefit across the country. And for most of us on this call and from the Black Caucus, we've always tried to do this for many, many years. If any of you follow House Labor Committee, that's a committee that good bills usually go to have a funeral and don't really get good hearings there because of the numbers. But the conversations have been taking place. So we're looking at strategy on how to use that bill or other instruments to make it happen.
Ted, let me ask you this while I have you here. Just a related question. What do you think session will look like once you guys open back up? Will lots change in light of COVID, or
those conversations, Jade, unfortunately, we learned via email about going back. I would hope, and we, especially from the Black Caucus standpoint, we've asked that if we do go back to session, which has already been decided, that we only focus on getting a budget out, capital outlay, and focus on legislation that is COVID related. I'm hearing that we will have a wide open session where we'll be putting people's life at risk to debate license plate bills and neighborhood improvement districts. And I think there's a bill out there regarding the state bird or something like that. So our colleagues on the other side, they want to open up session to do things like tort reform. For us on our side, we have asked that if we do, and now the decision has been made, if we are going to put people's lives at risk, let's do so and only do those instruments that are essential. But it's very early, like I said, we just learned right before we started tonight that we were actually going back. So I know that those leaders and those folks that are going to be there at the Capitol are going to make sure that we continue to ask that we're only addressing critical issues and those that need to be addressed for the state to function.
Okay, Ted, thank you again. God bless, and we'll definitely be hearing from you again soon.
Thank you.
We have one more question, and that question is for Dr. Shervington. Dr. Shervington, how can we, the Black community who are not comfortable in hospitals, advocate for at least verbal communication with a family member isolated in a hospital?
Well, I would challenge us that if we have a family member in the hospital, we have to find a way to get some comfort with it, because if all we can do is speak verbally by telephones, we have to do that. And, you know, in all our families, we have somebody, the person who turns up, who always cut up, who has a voice, and we need that voice to be able to get through so that we can let our family member who is isolated know that there is energy, that we're thinking about them and we want them to get well. So I would say we have to suspend for now our discomfort to know that this is all we have right now. We need to have a deeper conversation. I heard in one of the representatives' conversation, one of the reasons why we die, that if we don't know how to fight in a hospital for rights, we don't get the proper care. So, but for now, I would just ask us to suspend our sometimes rightful distrust of the system, but know that we need to let the loved one who's there know that they're loved and they're supported.
So thank you, Dr. Shervington, so much. This is Judy Reese Morse with the Urban League of Louisiana, here to thank you, to say thank you to Jay Brown Russell, who did a phenomenal job of moderating all of our discussions, to all of our speakers. Thank you so much for sharing your insight, your personal experiences, and your recommendations with all of us so that we now know how to move forward. I want to say just a couple of things as we close for tonight and get ready for tomorrow night. Night 2 of this 4-part town hall series brought to you by the Urban League of Louisiana and the Louisiana Legislative Black Caucus will focus on affordable housing as a social determinant impacting African American health. We've got some great speakers lined up. Please go to our website to learn more about who they are. We'll start at 5 p.m. Central Time tomorrow, and we'll look to go about 90 minutes. Great speakers from across the state talking about the impact of COVID-19 on housing, what those challenges were before the virus, what they are now, and what we should be striving for after we are past this pandemic. So please join us tomorrow night, night 2, affordable housing, in this town hall series called From Disparity to Parity. I also want to remind everybody that we are still participating in the 2020 census. This is one of the most critical issues that we will face as a country, particularly communities of color. We have got to participate in the census. A short number of questions, less than 10 minutes to complete. Please go to the Urban League's website to get a link to go directly to a form to fill out so that you can be a respondent. Much of the federal dollars that come to the state of Louisiana for a number of programs that communities of color rely on are determined by the response rate of the census. So we have got to participate. We've got an extension from the U.S. Census Bureau. We have until October 31st. We must participate in the census. So please go to the Urban League website. If you're not registered for tomorrow's town hall, you can register for the town hall there. You can also get a link to the Census Bureau site to complete your census form. Finally, if you are in this town hall meeting and you would like to receive information about mental health resources, we will be sending an email to everyone who is a part of this town hall so that you can use those resources. You can share them with others who may need them. We will be getting that information out to everyone. Is Senator Harris still on the line?
Yes, I'm still here.
Senator Harris, you have the last word, please.
All right, thank you. Out of respect for time, I'd just like to echo the words that you just stated. But I would also want for people to know that on behalf of the Louisiana Legislative Black Caucus, we thank each and every one of you all for being on this call. I want to also extend a thank you to the governor for extending his stay-at-home order, because we know that, again, that is something that's so very important to our community. As I stated earlier, 56.25 of those are infected are Black, of ethnicity, again, out of 3 categories, 74.92, again, are Hispanic Latino. So one thing I definitely have to stress, let's please continue to follow the guidelines that have been put out there. So let's continue to practice the social distancing. Let's only go out for essential items that we need. Let's continue to keep our hygiene and things of those natures going, making sure that we use our sanitizer. And last, please don't forget to wash your hands frequently. Doing these things, as we've seen, we have been able to slow the spread of this disease, and we've been able to keep some people alive. And that's what our goal is, as many of the other individuals stated before this. The goal is not to try to get the economy back up and running. It's about saving people. We do no good to anybody if we're building upon corpse. So on that note, again, thank you all for tuning in, and look forward to hearing and having everyone tune in tomorrow and the subsequent days to come. So again, thank you.